Welcome to a YouTube video, where we are going to discuss gestational diabetes with you today. Pregnancy can be an exciting and sometimes worrying time for many women. However, some women may experience a condition called gestational diabetes during their pregnancy. Gestational diabetes is a condition that occurs later in pregnancy, when blood sugar levels are higher than normal. This condition can have implications for the health of mother and baby, and requires proper management. In this video, we will cover the basics of what gestational diabetes is, why it occurs, what the symptoms are, and how it is diagnosed. We will also share information on dietary recommendations, exercises, and treatment options for women with gestational diabetes. Remember, when gestational diabetes is managed correctly, you can minimize the negative effects for both mother and baby and have a healthy pregnancy. Are you ready? So, let's start watching the video to learn more about gestational diabetes and its important points. Gestational diabetes is a diabetes that occurs in pregnant women. During pregnancy, hormones in the body change, and these changes can affect sugar metabolism. Gestational diabetes is a condition that occurs in pregnant women because the body does not produce enough insulin, or the effect of insulin is reduced. This leads to high levels of sugar in the pregnant woman's body, which can affect the healthy development of the baby. Gestational diabetes occurs temporarily after childbirth and returns to normal after the pregnancy ends. However, women with gestational diabetes have a higher risk of type 2 diabetes in the future. Gestational diabetes can be prevented or controlled if pregnant women pay attention to their diet and engage in regular physical activity. The symptoms of gestational diabetes are often obvious and not very common. However, some pregnant women are more likely to have gestational diabetes. In this case, the pregnant woman's doctor should measure her sugar levels regularly and treat her if necessary. Symptoms of gestational diabetes may include frequent urination, excessive thirst, overeating, and abnormally rapid increase in kilogram gain, extreme weakness and fatigue, painful wound healing, abdominal pain. Gestational diabetes usually occurs after 24 weeks of pregnancy. However, some pregnant women are at higher risk of gestational diabetes and therefore may develop it earlier. For example, pregnant women with gestational diabetes or type 2 diabetes in previous pregnancies have a higher risk of gestational diabetes. Pregnant women who are overweight or obese also have a higher risk of gestational diabetes. It is therefore important that pregnant women are regularly examined by their doctor and undergo the necessary tests. This way, gestational diabetes can be detected early and preventive measures can be taken. Gestational diabetes is a condition that occurs in pregnant women because the body does not produce enough insulin, or the effect of insulin is reduced. Pregnant women at higher risk of gestational diabetes had gestational diabetes in previous pregnancies, those with type 2 diabetes, over 35 years of age, those who have no family history of diabetes but are overweight or obese, those who had babies weighing more than 4.5 kilograms in previous pregnancies, those with polycystic ovary syndrome, those with high blood pressure, those who do very little physical activity. If you have one or more of these risk factors, you can take preventive measures for gestational diabetes by talking to your doctor. Gestational diabetes can be prevented or controlled if pregnant women pay attention to their diet and engage in regular physical activity. This can reduce the risk of gestational diabetes and support the healthy development of the baby. Expectant mothers with gestational diabetes should follow a proper nutrition plan during their pregnancy. In this way, they can protect their own health and support the healthy development of their baby. Here are the characteristics of the diet of expectant mothers with gestational diabetes. Avoid foods that contain a lot of sugar on a regular basis. These may include sweets, drinks such as cola, baked goods such as biscuits and cakes, and canned fruit. Regular snacks should be taken between meals. These snacks can include whole grain cookies, fruit, yogurt, and protein-containing foods. At least 6 servings of grain foods should be consumed daily. Grain foods can be foods such as whole wheat bread, pasta, rice, boiled corn, Eat at least 3 portions of meat or meat-like protein per day. Meat-like proteins can be foods such as chicken, fish, beans, and chickpeas. Eat at least 3 servings of milk and dairy products a day. Dairy products can be foods such as yogurt, cheese, and milk. Eat at least 2 servings of vegetables a day. Vegetables can be foods such as boiled cabbage, broccoli, carrots, tomatoes. At least 2 servings of fruit should be consumed daily. Fruits can be foods such as apples, pears, oranges, bananas. It is important for expectant mothers with gestational diabetes to follow a nutrition plan prepared by their doctor and dietitian. The birth weight of babies of mothers with gestational diabetes may be higher and treatment may be needed for their babies to develop healthily. Treatment methods for gestational diabetes are as follows. It is important for expectant mothers with gestational diabetes to follow a nutrition plan prepared by their doctor and dietitian. In this way, they will be able to get all the nutrients their bodies need and gain weight in a healthy way during pregnancy. Expectant mothers with gestational diabetes should do light physical activities that they can do regularly during their pregnancy. These activities can be light exercises such as walking, swimming, and cycling. If the expectant mother with gestational diabetes cannot control her sugar levels with regular diet and physical activities, insulin use may be recommended by her doctor. Insulin is a drug that replaces the naturally produced hormone in the body and regulates sugar levels. It is important that expectant mothers with gestational diabetes are frequently monitored by their doctors. In this way, necessary precautions can be taken regarding the development of the baby. In this video we have discussed gestational diabetes, and I hope we have provided you with useful information. Remember, gestational diabetes can be treated and managed properly, following your doctor's advice. You can follow a healthy diet, exercise, and, if necessary, take medication. In this way, both your health and the health of your baby will be protected. If you have been diagnosed with gestational diabetes, or think you have symptoms, it is important to contact your doctor. Your health care provider will provide you with the best treatment plan and guide you through your pregnancy safely. We hope this video has helped you learn more about gestational diabetes. We wish you a healthy and happy pregnancy. Thank you for watching, and we hope to see you again in the next video. If you are interested in health-related topics and would like to learn more, consider subscribing to our channel. On our channel you can find informative videos on many topics such as healthy living, diseases and their symptoms, treatment methods. Don't forget to subscribe so you don't miss our new videos. We wish you a happy and long life.